Hello, I am Dr. Sandhya Rani, Senior Consultant Obstetrics and Gynaecology Department, Aster Women and Children Hospital, Whitefield, Bangalore. Today we are here to discuss about urinary tract infections in women. So obviously UTI means infection of the urinary tract. It can be of lower urinary tract or the upper urinary tract. Lower urinary tract infections are very common and most common in women. Why is it so? It is because of the anatomy of the female urethra and urinary bladder. The urine passage is quite close to the motion passage, and that is why most often the bacteria migrate and cause infections. There are other risk factors for urinary tract infections as well, like if a woman has a disturbed structure of the urinary tract or if they have any stones. Urinary tract infections are more common in women who travel or use public washrooms. If your immunity is low because of diabetes or any medicines which lower your immunity, you are more prone to urinary infections. Urinary infections are also common in pregnancy, in newly married women, and very common after menopause. So, how do you identify urinary tract infections? So, if you start having frequent urination, like every 5 to 10 minutes you're needing to go to the washroom, or painful urination, so pain could be at the beginning of the urine passage, or at the end, or during, or if it is a burning urination, or if you notice that the urine color is quite cloudy, or you see blood in the urine, it could be a urinary tract infection. You need to consult the doctor immediately. So what do we do when you come to us? We would first do a physical examination if needed to rule out other infections or other causes for the urinary infection. We may be suggesting a urine test. It could be a routine urine analysis or urine culture which confirm the infection. And then if needed, we may also ask for an additional test like ultrasound to rule out any stones in the urinary passage which could have triggered the infection. After we get the results, we would be suggesting certain medicines. It could be something to reduce the burning sensation, we could give pain relief medicines, and antibiotics may also be prescribed. The duration of the antibiotic usage varies with the type of infection and the duration of infection. Why do we need to treat urine infections? Because if they are left untreated, they spread to the upper urinary tract, that is the kidneys, which can be very fatal. And urinary tract infections, if they are not treated in the first instance, can lead to reoccurrences or relapses. That is why the first episode has to be treated very diligently. Urinary tract infections during pregnancy can cause preterm labor. They may also lead to low birth weight babies. Urinary tract infections may also lead to a lot of discomfort, leading to absence from work in women. So is there something you can do to avoid these infections? Yes. First, hydration, taking lot of fluids. Avoiding the usage of public washrooms, or when you use them, make sure that you flush them properly and then use it. Carry your own sanitary kit so that you can ward off the infections. Taking good amount of vitamins in your diet improves the immunity and makes you stronger from within. So, prevention is definitely important. Early diagnosis and treatment of urinary infection is important. And we at Aster Women and Children, Whitefield, are available round the clock. And if you notice any symptoms of urine infection, just reach out to us. The tests are available round the clock and we can give you the prompt treatment necessary to clear the infection. Hope this was helpful. Thank you.